plastic surgeon are trying to wrap around the aesthetics to say that aesthetics is mine. So, and that's what they have been marketing. In UK, you and me can go and do an online course and we can start doing fillers. Once you see the sign, the first sign, you only have 45 minutes to save the eyes.
So maybe good takeaway, is an eye-opener. So whoever is going, we can ask them, do you have emergency kit with you?
They're going to say yes. I'm 55 years old.
You don't look like.
And people is like, how do you do that? And I said, it's hard work.
In a world chasing success, we chose to slow down, listen, and re-engineer from within. After 2 documentaries and 40 plus powerful stories that moved hearts worldwide, this is the Re-Engineered Club.
Hello, good evening, everyone. Welcome to another exciting episode of the Re-Engineered podcast. Myself, Madhusmita NAYAK, the host. And today, we are going to talk about beauty. Yes, the one topic which we all love. But the fact is, today we are going beauty as a responsibility. Beauty not as an outcome. And to support this and to discuss this and to share her expertise, we have Pin Lim all the way from Singapore, who is a leading voice, and she's re-engineering in the world of aesthetics. So please join me in welcoming her and learn more about beauty segment, aesthetics industry, and how ethics and governance actually can make it better. Welcome, Pin, to our episode, and it's a pleasure having you.
Thank you for having me. And it's a nice surprise. I think we talked about yesterday how we actually ended up here.
Yes, absolutely. And I think we are in the month of love, Feb month, Valentine's Day special. And beauty is such a thing that everyone craves for it, right? And you look beautiful with your glassy skin. And you are actually advocating for beauty with ethics and responsibility.
Definitely. I've been doing that since 2006. And myself, I've actually moved to Ireland in 2006. And before that, I was actually living in New York. And what brings me to ended up setting up a clinic in Ireland was because I initially, there was a big opportunity that I know that because in Singapore and in New York, it was actually very much saturated industry, and everybody is talking about, loving yourself. And if you remember Sex and the City, one of the scenes is that you don't have Botox, something wrong with you.
Yeah, that it has become so common,
exactly,
right?
It has become so common, and so when the opportunity popped up that I can actually open up a clinic in one of these 3 countries. So of course I choose Ireland because Ireland was at that point of time in Europe was just starting to start to recognize it, but a lot of the women are still treating Botox and fillers as a taboo, and also they kind of feeling very guilty about it. So they have to hide from their husband. They have to. It's kind of I want to do, but I don't want anybody to know it.
Okay, so they're hiding but they really want to do it.
Yeah.
But how contradicting it is. Now in today's world, we are talking about sustainability, going back to nature, but still we run after Botox, filler, and even our Instagram feeds and all that is filled with all this.
Exactly, because the times has changed. I mean, back then was 2006, and because in other country, you see, in Ireland is pretty much very, very much influenced by anything in America is happening. They are anything that is America, that's good. So they follow the trend there. So if you look at the trend in the US for aesthetics, Asia, Korea is of course the leading the game. Before that was Japan, and then Korea take over, and America follow
those
the
countries.
trend, and then Europe then follow the America. So that is within the continents. That's how the trend is actually being developed. So for me, Ireland actually has the best market because it's just peeping up. So it would be the best time for me to actually establish a clinic, aesthetic clinics over there, and try to kind of educate. But it was also that time, while I'm building up the clinic, I realized that I started to see the industry, how actually doctors are being trained, how doctors and surgeons can get into this industry. Basically, there's no regulation. Anybody, as long as you're a doctor, as long as you're a surgeon, you can start performing aesthetics procedures. It doesn't matter how you do it, how you learn it. It could be going to a congress, sitting up in the seats where you watch people perform, or it could be just go to a product training 2 days, and then, or you can look at YouTube video, and you can start doing Botox and fillers for people. And that was from me coming from a background. I'm an IT consultant before that, which is very structured and very governance.
Very regulated.
Very regulated. The mindset of coming from Singapore, how regulated it is. And then from the US that I know, because I myself, I actually have gone through breast surgery. And when I finally setting up these services, and from a patient perspective, it was horrified when I said that. I was like, that's it? Is that how you just a doctor? You haven't learned anything.
Yeah.
You mean now you go to 2 days course and right now you're actually, you can inject me or don't touch my face.
Yeah.
Even for myself, I was horrified. And that's why, and doctors, you can go to, like for example, a liposuction, the product company pretty much is very commercialized. So it's driven by the commercial
Profits, money.
Yeah, the commercial company that, okay, if I want to sell this device to you, I give you the training, you can start performing it, whether you know it or
You are not proper in utilizing
so
that.
there's nothing, because it is not a specialist. Aesthetics, medicine and aesthetic surgery in many countries is not a specialized area. So therefore, doctors they don't have to go through that kind of a training, rigorous training, just like a plastic surgeon that needed or a dermatologist that needed.
Okay.
So you can be a dermatologist, or you can be a plastic surgeon, but all your training is never aesthetics. It's more functional. Plastics will be learning more about reconstructive work. So that gap itself, that nobody, if they want to learn, they have to kind of figure themselves out, going to congresses, going to product training. So that's when I say that I really need to create a proper training school.
And make it more structured.
Yeah, exactly. Yeah. And that's where European College of Aesthetic Medicine and Surgery was born in 2008. So within that 2 years itself, that, so unstructured, I decided. And because then I have actually attended enough congress to know who are the experts, who are those qualifier that has a lot of many years of experience. And I approached them. I remember the first person I approached was one of the plastic surgeon in actually Italy. And so he's so-called the kind of a pioneer and the first few people to learn about liposuction. And so I flew over to him and I pitched the idea to him. And he's like, it's a great idea, but I don't know how to do it. If you can do it, I'm in. I was like, great. So
and it's an eye-opener, right? Like, you are telling that this is not structured and anyone can come into aesthetics medicine or aesthetic surgery if you're a plastic surgeon or you are a skin specialist. And there is a huge gap. But saying that, how as the end user, like, we will be trusting this? And before getting into that, what is included in aesthetics medicine and aesthetic surgery?
So there is aesthetics, which is more like the beautician, salon, tattoo. Those are also known as aesthetics. But you have aesthetic medicine. So those are all the non-surgical procedures. So non-surgical procedures would be all the injectables like Botox, fillers, medical devices.
And lipo?
Liposuction is considered as minimally invasive. So it is between surgical and non-surgical. They are in between.
Okay.
Because and also it depends on the techniques of liposuction. Certain doctors do liposuction under GA. certain do it under sedation, and then certain do it under local. So even that itself, within the liposuction itself, there is 3 different way of delivering it. And of course, the 3 different way affect the outcomes. And also it affect the, the downtime, and also the area, how much I can be treated, because it's all within this, you have to be within the safety limits of the tumescent fluid, the numbing solution that is actually being injected into your body. So it is a science, but as much as it is also an art, but pretty much a lot is mostly science behind, science-backed based procedures. So, and the fact that because it is so commercialized and it is still elective procedures, and it is a huge industry, huge pot of money that every doctors wanted to get into it. So I can see the reason why a lot of the regulator would not want to make this into a specialist register, because imagine if you put that as a
regulation
to say that now I formally recognize this as a specialist register, there will be nobody wanted to work for regular hospital.
Yeah.
And so I can understand the reason why, but then at the same time, I think there should be also enough regulation because you can't control, if you can't control the pretty much the regulation, but within the body itself, from my perspective as a patient and as somebody that actually run the education, to me is that then the doctors have to be properly educated.
Absolutely.
Because only if the doctors are properly educated with
and competent
and with the knowledge of how to handle complication before they even start to inject or before they even start to do any surgery. And that's when the only way is through education. They understand the science behind, have a science-backed, evidence-based, unbiased, so that you will not, every decision is actually not affected by commercial. It's not because I'm trying to sell a few more mils of fillers, or I want to put more units of Botox in there. So, or maybe, do I really need a laser skin resurfacing, or do I really need a liposuction? So the ethics has to get in before the commercial comes in. So that's why all this, we're hoping what we can achieve is through ECAMS, which is hoping that if I'm able to expand this community where all the doctors have the same high standards
and mindsets,
delivering the same thing, being ethical, science is important, I think they will stop looking at it as arts. Because when you start purely looking at aesthetics as an art form, standards drop.
Yes.
Because arts has no wrong.
Yes.
Arts depends on how you see it.
Yes, and but at the same time, as you are dealing with human body, we need to be safe too.
Exactly.
Yeah.
Because there is the extent of a complication is actually huge. I mean, you will think that I'm just going for a lip filler, or I'm just going for a cheek filler, I'm just going to do a little bit
nose work.
These are just injection. But the reason, the end point behind is that, if you hit a blood vessels or you have embolisms, the fillers get into any of the arteries, you can go blind, and you can go necrosis, which is, your nose and all these are reconstruction work. So something that is so simple that you thought that, it's easy, I just lie down and I can have my face done, I'll be rejuvenated. But then they don't
they don't see the after effects.
They don't see the potential that might happen if the doctors are not properly trained and
qualified.
Even if they're qualified, because a lot of times when they go for any form of a training, product training or whatever, their focus is that know your anatomy, avoid complication. It's like, okay, what if complication really happens? You cannot just avoid complication. Avoid complication is important, but you must know how to treat the complication.
Yes, and before getting into that outcome, we better be preventive.
Exactly.
And not getting into reactive, but saying that this is a very, very Like, I can see there is a lot of risk, complications, and the end user, like we as a public,
Exactly.
when we go, we are clueless and we don't know what is the outcomes if someone is selling. So we actually have a trust on the doctor.
I think that's human nature, right? Because we all trust doctor.
Yes.
You go to a GP, you expect the GP to fix your sinus or your flu or your headache.
Yeah.
Or when you go to a dermatologist,
Thinking that he's qualified to treat me.
Exactly.
Yeah.
So you know that, okay, a dermatologist will fix all my skin issue. If I go to an orthopedic surgeon, it should fix my bone. And if you go to a plastic surgeon, it should, technically speaking, like behind the scene of all these different industry, because aesthetics is a multidisciplinary industry. So not necessarily even as much as very controversial. I know that if I say this, a lot of people will agree with me and also disagree with me, is that the plastic surgeon are trying to wrap around the aesthetics to say that aesthetics is mine. So, and that's what they have been marketing. It's like, plastic surgeon should own the aesthetics field. However, dermatologist is doing all the injectables, not the plastic surgeon. In fact, most plastic surgeons are not trained to do injectables. And most plastic surgeons during their residency, they are not trained to do aesthetic surgery. They are doing reconstructive work because all their training is in a hospital. Hospital don't have aesthetics. You don't have a woman that walk into the hospital and say, please give me a facelift. No. So all their training is on reconstruction work. Somebody has an accident. So then when they finish that, when they want to divert themselves into aesthetics, they have to get additional training. And that's where, again, the structured training come in place, which they still have to go through that. So whether if they are, as much as it should be classified under the plastic surgeon, which that's what they would pretty much want to in the marketplace, maxillofacial surgeon can equally as competent as doing a facelift, or ophthalmologist can do an eyelid surgery, ENT can do a rhinoplasty, orthoplasty. So it become very multidiscipline.
And all like, interjecting.
Exactly, all interjecting. And gynecologists do the aesthetics, genital rejuvenations. Urologists do the male, and they also do the female part, because it depends on whether which specialty. So every specialty has its specialized area. Hair transplant can be done by emergency, anyone, because the hair is also another area where it is aesthetics, but no training is teaching them about hair. It cross between, sometimes a hair transplant surgeon has to work very closely with a dermatologist because it depends on the problem,
scalp.
the scalp. Yeah.
Scalp.
So once it goes into the skin layer, then okay, the dermatologist need to treat it first before I can start doing hair transplant. But all this is also very important because a lot of times patients think that, okay, if I go to because right now a huge part of Turkey is hair transplant. If you go to Turkey, the whole airplane is full of hair transplant. You know that, okay, they come from Turkey. So, but the thing is that they make it so easy and so transactional, but they have forgotten that actually before you even start diagnosing, are they having alopecia? What form of alopecia? What type of alopecia? Are they suitable to do a hair transplant? Do they have enough hair graft to actually graft? And at what age should you start grafting that? Because if they have hereditary alopecia area problem, and you actually start doing the hair transplant for them at the age of 20-something, you are moving all these grafts to the front. But by the time when they really, really need it, by 60 years old, they don't have enough graft to. So those decision is important. And if you just go to anyone that is not properly trained without that concept, without knowing it, it becomes unethical practice.
And they just do it. They give solution. So what I understand is like diagnosis before getting into treatment is so important.
Exactly.
And now, because I must not say not qualified, but less qualified and getting into all this is actually creating a problem.
Yes, exactly. So there is like
Yeah.
in Ireland and in UK, the issue goes even worse. At least in Dubai, I think there's some form of control. In Ireland, nurses can do injection. Well, there's few countries that nurse can do injection. So you have the US, Australia, Ireland, UK, and I think South Africa. I don't think Dubai they are allowed. I'm not so sure. I don't think so. I think Dubai only dermatologists can do the injection. But out of all these countries,
So when you say injections, means aesthetic injections?
Botox and fillers.
Oh, Botox and fillers. Yeah.
So nurse can do Botox and fillers, and let's push it even further. In UK, you and me can go and do an online course, and we can start doing fillers.
Really?
Yes.
Like it is so not governed?
Yes.
This is really an eye opener.
And this is
yeah.
scary. So on top of that, so as a patient, from a patient perspective, I really wouldn't know whether who can, who can't.
Yeah, so that's a very great point, Pin. So as an end user or as audience listening to us, how to make sure that we are going to the right person?
Okay, firstly, for me, because I'm in Ireland, even though I know that nurse can do injection, and some of them could be very good and very competent, and it's the same in the US. You can see some of the nurse injector, they do know what they are doing, but still, I would never risk that. Because what happened is that, for example, in Ireland, the regulation is in such a way that the nurse, or even in the US, most of the time, nurse can inject, but it must always have a doctor's supervision, even though they say that, right? So that is the guideline. It's not a regulation. So anything that's not legal is just a guideline. So I could have if I set up a clinic, I have a nurse injector. As long as in the clinic I have a medical director, whether the medical director is there or not, is you can't check.
Yeah.
You can't check. So say, for example, God forbid, inject me and I have a complication. The nurse are not allowed to dissolve the fillers because they are not authorized. It's a drugs. So they can't prescribe without a doctor's supervision.
Okay.
So then, I can't be waiting for a doctor to come and save me. What if the doctor is not around? What if the doctor is overseas? I'm not going to risk that, because blindness, if you hit any arteries, so there's two forms of vascular compromise, right? So one vascular compromise, once the fillers get into the arteries, sometimes immediately you can see it. So the doctors or the provider need to be able to identify that signs. So knowing the signs is important. So, but some of them, it takes 2 weeks to 3 weeks. You could be out in the holiday thinking that you have just injected the person, everything was fine, she's happy. She can call you up and say that, I have severe pain. And then you'll be like, that's 2 weeks ago, why are you telling me? And then you might just dismiss them away because you're not trained to identify signs. But that could be related, but you need to start then going through all the protocols to say that, okay, do you have this symptom? Do you have that symptom? Show me your picture, send the picture over. And you need to
Address it immediately.
Exactly. Once you see the sign, the first sign, you only have 45 minutes to save the eyes, or else you lose your eyesight.
You become blind.
Exactly. And
have you seen such scenarios before, like cases?
not in real life, but I read a lot of paper. I have heard a lot of cases. I think there's this influencer from America. She flew to Korea to not even for kind of a deep injection. She's just having a skin kind of mesotherapy.
Okay.
But
Mesotherapy.
using PDRN, which is the salmon sperm, which is right now very popular. But she go blind on one side of the eyes.
My goodness.
And you're talking about Korea.
Yeah.
Skincare is not something that you only think of it when you start working money and you have money, right? Because I think in the rest of the world is that, okay,
Yes.
when you start afford, you can now look after your skincare. In Japan, skincare from the age of 3 and 4 years old, they are being taught This is part of your routine, just like brushing your teeth. You teach your toddler how to brush your teeth. They teach them how to make sure you have sun cream, make sure you have a special cloth, like when they go to the school, the little kids, they have to bring 2 special handkerchiefs, one for the face, one for the other part of the body, so that when they wash the face,
They use that particular.
and then they have to have a little cream that they bring with them to moisturize.
If this story moved you, don't just scroll. Share it, start a conversation, and subscribe to be part of something that redefines what it means to grow. And if you have an inspiring story, please get in contact with our team, info@reengineeringclub.com.